Good afternoon again, and welcome to another edition of SafeSpace with Pastor Wale Afelumo. I'm glad that you are watching our episode today. Remember to get your friends on board and share the links. It's going to be an exciting one today. We'll be discussing an exceptional group of people called special needs children. And the objective of this really is to bring enlightenment, to also bring awareness to our authorities, our governments, to also give help to parents who have children in this category, who are special needs children. They usually will be children with some form of maybe learning disabilities, disabilities in their motor skills, and it can be life-threatening in a number of cases. In short, they are just children who need special care and special attention, and they live amongst us. They are gifts of God. But I know sometimes as a society, we really don't understand. We find it hard to grapple with that group of special children. So today we basically just want to talk about that. Remember to subscribe to my YouTube channel. This will be happening on YouTube. It will also be happening on my Facebook page. And there's an audio version on Mixler. You'll be getting the details at the bottom of the screen. But I want you to especially be on YouTube because our guests will be on YouTube to answer questions. So it's a live session, but we are recording it ahead of time. But while it's airing on YouTube, I will be discussing live in the chat box and we'll be answering questions. My name is Wale Afelumo, and I'm going to have two guests today. Our first guest is a couple, a beautiful couple. I'll introduce them to you shortly. They are parents, and then after that, we're going to have a doctor. Now, I want this discussion to be as exhaustive as possible. So next week, in 2 weeks' time, this comes every fortnight. In 2 weeks' time, we'll also be discussing this, and we'll have an educator of special needs children. Very shortly, I'll be introducing my special guests to you. But remember, subscribe to the page and like the channel, and like my Facebook page, and subscribe to this channel. Thank you very much for joining us again. Now, my guest, like I said, is an amazing couple. They've been married for a little over 4 years. They are Mr. and Mrs. Julius Obomokhai. Julius and Zainab Obomokhai. I've known them for several years now. They are parents to a special needs child, a beautiful, handsome boy, just a special child. And I'll be talking with them today. Julius is a thespian. That's what he said he is. That means he's into drama, acting, theaters, and all of that. And he's a writer and a director. And his wife, Zainab, has a bachelor's degree in mass communication. They'll be joining me today. Friends all over the world, I'd like you to welcome with me on set Mr. and Mrs. Julius and Zainab Obomokhai. You're welcome.
Thank you, sir, for having us.
Yeah, greet our viewers.
Thank you, viewers.
Okay, it's good to have you. I basically must appreciate you for choosing to be on the program with us. I know that, especially in the society we are, people say, there's a saying that people fear what they don't understand, and people are ashamed of certain things. So I want to thank you for overcoming all of that, the social perception, to be able to talk about this. And I know what has prompted this is so that you can be a source of help to somebody out there. And that has happened with several of our programs. So I thank you. And it's a Saturday, and I know that this is the time that husband and wife usually will do catch up, and several other things that I may not want to say on set. Thank you very much. Thank you. So tell us about your boy. What's his name, and when was he born, and about it. Let me start with mommy. Yeah?
Okay. Our son's name is Julius Obomokhai.
Okay.
He was born on the 5th of September,
Okay.
2017.
2017. That means he's about how many years now?
He will soon be 3 years. In 2 months' time, he will be 3 years.
Wow.
Yes.
That's amazing. And I understand he has a younger brother now.
Yes.
Okay,
By the grace
so
of God.
so you're expecting a sister to maybe like next year.
Okay.
Okay, that's amazing. Thank you very much. Now, so you had this child about 3 years ago now in September. At what point did you start noticing that, okay, there may be some challenges, with our baby boy? Maybe daddy should help with that.
So It happened 2 days after life.
Wow.
That I was given birth.
That early?
Yeah, we realized and noticed earlier on that the way he cries was a bit abnormal, and we actually took him to the hospital right away.
Wow.
The doctors.
When you say a bit abnormal, what can you describe?
The way he get to cry, get to stretch and turn his
It's
eyes.
a lot. Okay, turns his
Yeah,
eyes.
and get
Comes
to
with a lot of
twitch.
effort, and
Yes,
it twitched. Okay.
yeah. So we took him to the hospital. The doctors told us that nothing is wrong with him. That he's just being a child, a baby.
Wow. This was like how many days into
The following
life?
day, we went to the hospital.
Wow.
Yeah, after we noticed it, we went to
Wow.
the hospital, the government hospital. So they told us nothing was wrong with the child. We went back home. Then I think it was on a Friday. Then we noticed the same pattern. You know, it didn't stop. I told my wife, I don't think all is well with this child.
Wow.
We went back. Well, as God and faith will have it, a consultant was at hand to check the child. And immediately she noticed that the child was having seizures.
Wow. As early as
Yes,
that
sir.
age.
So we're placed on admission.
And those were not physical signs you could tell as parents, the seizures. You couldn't
they
tell
were-
that what was happening
Yes,
was
they were kind
were
of
seizures.
mild.
Okay, okay, they were mild.
But they were abnormal.
Okay. Okay.
Of course, when you know how babies behave,
Yeah.
they were just abnormal because of the twitching, the twisting of the eyeballs, and what have you. We just knew this is not something we should play with. So we're placed on admission for over 11 days.
Wow.
I remember asking the doctor severally, what's happening? Nobody was filling us in as parents. Of the 21st century, we decided to, go to Google to check. Because we're hearing that the boy was having seizure. Okay, what's seizure? Because we didn't know what seizure was. Started checking. Of course, for the little info that we had, I got from, Google, we just knew that, okay, this all is not well, but hopefully, since the doctors are on top of it, everything will be fine. For over 11 days, nothing happened. I asked the doctor, and the doctor told me, funny enough, the doctor told me to go and ask my wife. I mean, they are doing all they can. But I knew there and then that this hospital cannot do anything for this child. So I actually took the child away from the hospital. They were not happy about it. They said I shouldn't come back. I was like, well, good riddance. I went to the child. We took the child to other specialists. We're on admission for over 3 weeks. Now, for the first 2 weeks that we were on admission, the boy kept having repeated seizures.
Wow.
Nothing could control it. The doctors kept trying they carried out so many tests on the boy. In fact, there is no test known to man that was not carried out on that boy. But I remember one of the doctors told us that we should be patient, that there's one consultant that she's not around. Now, when she comes back...
Consultant in what? Can you remember?
She's a neurologist.
Neurologist, okay.
Yes.
I just don't want to call her name. That when she comes back, certainly she'll be able to, provide a solution to this. As parents, we were helpless. The boy kept having seizures, repeated seizures. And for what we have read, for every seizure, it affects, for every seizure episode, get to affect the brain cells, as a layman, for what we know. I wasn't happy about it, but then I was helpless. We were at the right place, but nothing could be done. So it took the doctor up to like 2 weeks. When she eventually came, at this time we had done all the tests. CT scan, all the tests, we've done everything. So she came and she administered some medication, and those medications, to God be glory, they kind of curtailed the incessant seizure the boy was having. So in a matter of 7 days or thereabouts, we were discharged.
Just to interrupt you, how did you feel as a mother? You just had a child, and then from the next day you are already in the hospital for weeks to come. That's when you should be trying to, press your tummy and regain your shape at home. And what was that experience like?
For me, I just wanted my son to be okay. I didn't really think of
yourself.
I didn't really think about myself at all. I just want my son to be fine. Yes, I will sit in the hospital. He'll be lying in his cot. I sit down all through.
Wow.
I sit down all through. Those days, I would just sit Sometimes my husband will be there. Sometimes he will have to go and sleep in the car as we're on admission, you know. And in fact, they kept, if I cry to them, like they say anytime, they gave me a chart that should be recording every of his seizures. So whenever he have any attack, I will just tell the nurses, nurse, come, this boy is having seizures. They'll be like, madam, you don't know what is seizure. This is not seizure. I'm like, in fact, the doctor even came to me and like, madam, this is not seizure. Please go and sit down. Stop disturbing us. I'm like, this boy is having seizure. You're telling me this is not seizure. From what I have read on Google, this is seizure. And they're telling me, no, it's not seizure. A child is turning his eyes, twitching, and turning blue.
Wow.
That is seizure.
Wow.
But the doctor said no, because, of course, before they will come to us, he has stopped. Because his own doesn't last up to a minute.
Okay.
The seizure that comes to him doesn't last up to a minute. So before they will get to me, it has stopped. And I'm seeing it. The next thing they will do is to give him diazepam to break it. They're like, okay, once he starts having this seizure, call us. Let's give him diazepam. And before they will get to us, the boy has stopped having seizures. So sometimes they just give him the diazepam just to give to him because I have come to complain to them that this boy is seizing.
And that also brings to question the professionalism, or should I say the customer relations of our medical professionals, you know, because if a parent is already distressed, seeing their newborn baby, a child they waited for, 9 months of pregnancy, going through that, I think a little empathy from our doctors and our nurses would have just been a sort of a succor for these parents. And that's why we're doing it, so that holistically we find a way to bring help to families in need in situations like this. So what eventually was the diagnosis? Were you told what the challenge was?
We were told that the boy had neonatal seizure since he started at birth.
Okay.
The day after birth, or so, 2 days or thereabouts. We were told that he had neonatal seizure, but the CT scan did not reveal anything, if I can remember. And other test results, they were all negative. Wow. Just the neonatal seizure thing. That was what, in fact, because of what you said about medical professionals, I can remember some of the doctors at hand then, even carrying their medical books. Like, seriously, sir, we've not really handled a case like this. Yeah, so they were. And
that's at the specialist hospital?
Yes. And they were trying to read about, neonatal
how to
seizure,
respond to,
how to tackle that. That's why during our stay there, before the consultant finally came, we didn't get any help. Like, we were just helpless. The doctors were just, and I just looked at the boy and the whole situation. As a father, I was heartbroken because my hands were tight, not just my hands, my legs too, they were very tight because there was really nothing I could have done at that time,
So how has the boy been developmentally now?
I wish I have a very big positive answer to this. It's been hectic. It's been hectic. Now, of course, the boy was placed on a series of anticonvulsants, series of medications, which we'll get to buy sometimes weekly.
Wow.
Yes, sometimes fortnightly, sometimes monthly, depends on the med. Then, of course, the boy has been placed on regular physiotherapy. This thing comes at a very high cost, very, very high cost. That I know that it's been good. It's been good. Now, doing all of this consistently and not seeing the desirable response or desirable result is very heartbreaking. Very, very heartbreaking.
Do you deal with regrets, if any?
The only regret I have prior to his birth was there's this particular hospital that told my wife when she was going for
antenatal
in Wuse General Hospital. They told her that the boy they are going to place her on Book for CS. I remember. And I was like, no, why CS? What's happening? Why CS? What's the big deal? No, let's just switch. That's the only regret I have. If
maybe that may have helped.
That may have helped. Okay. Perhaps there were things they saw, but they didn't tell her anything.
No,
what was their reason?
The reason for the CS Because before I took in, they noticed a fibroid.
Fibroid.
So they are now suggesting that if
It may also be a good time to remove this fibroid
yes,
or what?
that if at all there is any need for me to go through that, that they will use the opportunity to remove the fibroid.
Okay.
But the fibroid is not really blocking, so it's not something that can hinder the child from coming out or swallow the child or something like that. So I told my husband about it, and he was like, no, I don't think there is any point.
Okay, I'm sure some of the other questions I have, maybe when our next guest comes up, the doctor, because I know that it presenting like a CP case, like a cerebral palsy, which sometimes may affect the child during childbirth, affects maybe a belabored labor, a stressful labor period. So, but then raising a special needs child, how has this affected you? Affected your lives? And you can go as far as maritally, career, physically, individually, financially. Let's do, because it's just good that people understand some of this.
Wow. Having a special need child is not something I would wish for my worst enemy. That's the blunt truth. That said, it's been very, very tasking and hectic. In our marriage, it's like a time bomb as far as I'm concerned. Any little thing, we're always at the edge. Any little thing will flare up and have issues, and instead of us to resolve it timely, we just allow it to drag on.
Just because everybody's dealing with the pain in their own way.
Yes, so it's. I would say this: if not for God, I don't think this union will still be. I think we'll still
Why
be together.
is that? Is it blame? Now, it may not. I know that when things like this happen, nobody's behaving rationally. But then, what usually is playing out? Is she thinking it's your fault? Are you thinking it's her fault? What's usually yes?
Funny enough, we've never really, thrown blames at anybody. Like she has never blamed me, and I've never blamed her for it. In fact, I used to tell her that I would go to the grave with this. That, as far as I'm concerned, the man of this house, I would have said, you know what, stick with this hospital. Like I said, that's the only regret I have. Because I just felt, why CS? Because of the mindsets that we have. I know CS is not godly. I know we have to give birth like the Hebrew women. No. Because we've gone to another hospital and they told us, no, we don't need CS. So we're comfortable. That's the only regret. So I take that, I shoulder that blame, because I just feel, what if?
But you're talking about how it has affected you guys. So you're talking about your marriage.
Yes.
If not for God, in what other ways has it affected you guys?
90% of the issues we've had is as a result of Maximus.
So it puts pressure on the marriage.
Pressure. Maybe I'm carrying him and his neck, fall to the back. My wife might just react, I'm not carrying him well. Like, what's that? I just get to react. I respond to stimulus as it were. And before you know it, you start exchanging words, insults. Well, not insults, but then words, harsh words. And before you know it, it prolongs. And I just realized that what's happening between us? Every issue we've had is because of this child. Because you're not happy. I am not happy, she's not happy. When you're seeing the child, there is no way you will have joy. It is only God that will give you joy when you have an issue like us. The problem is just there, staring you in the face every day. And the problem is a devourer. Devours you financially. In fact, in terms of finance, it's been God that's devoured us completely. I remember the savings we had before he was born. After he was born,
depleted
not even up to a month, consumed everything. Because of the series of tests, the medication.
So give me an idea, monthly, is it in the thousands?
Yes.
Wow, thousands of naira.
His least medication is, Kamasa sells for like 3.8 or thereabouts. Wow. And you get that weekly.
Wow.
Yes, you have to get that weekly.
No, it's not even weekly. I think
it's not even up to.
It's not up to a week anymore. Like 4 or 5 days.
4 or 5 days now.
Wow. Because we have to increase the dose.
Yeah, there are other ones that there's this oil that they say we should be getting for
Clonazepam,
45,000.
45,000.
What?
RX, Omega
Yes.
RX. Omega RX,
Wow.
45,000.
And so this is
And
happening.
Cifavo.
This is happening, and the child needs a lot of attention and time, right?
Yes.
So that may also have affected your career. You can't just get on the street and hustle like you would like to.
In fact,
What's happening with your time and your career?
Oh my Lord. It's just as if I am in a prison.
Wow.
That is how I see it.
Wow.
I am indoor 247.
Wow.
I can't really go out with him because
Wow.
one, he cries, and when he's crying and people around might not really understand why he's crying, they might start looking at him like, what is wrong with this boy? And because of that, I can't really go out with him. That is one. Noise too he doesn't really like staying in a noisy environment. So that can really trigger the seizure. So I stay indoor and taking care of him. The way he eats, it's not everybody that can actually feed him.
Wow.
Because it's difficult for him to swallow.
Wow.
So if you don't place him well, it's not everybody that can bathe him.
Wow.
Because when
so the neck is not as firm as it should be.
And
so
then
certain
he's
milestones
spastic.
have been missed.
No.
It's spastic. That
He's
means it can go
spastic.
into.
Yes.
Okay.
So because of that, not everybody
Wow.
can really take care of him.
Wow.
It's only take and carry him properly. It's only me, my husband, and then few siblings.
Do you get any support from extended family, friends? What's your experience been like? You know, any kind of support?
Well, we've been getting support, of course, especially from friends and families, people that are sympathetic to us, have light once in a while, though. Well, I thank God the church, in our wisdom, decided to also place the church headed by you, sir, so that the people know.
Okay, this is not about the church. Okay. So the church has placed the boy
on a monthly
just
stipend.
a small stipend to help the boy monthly. Yeah.
And that has really helped.
Wow.
Of course, another family,
Wow.
yeah, the Okechukwus,
Wow. Awesome.
yeah, they also did something for us.
Awesome.
You know, just to help and to try and see how they can be of a blessing to us, because truly there's been like a drop in support. It's like a drop in a mighty
Compared
ocean,
to
because-
what you have to expend.
Yes.
Wow.
Now we're not talking about taking care of ourselves now or our other son.
Wow.
We're just talking about the boy, Maximus.
Maximus.
Yes, just talking about him. The physiotherapy
Awesome.
session that you get to pay,
Wow.
it's been
Awesome.
overwhelming.
Awesome, you know, and that's why we are doing this. It's just for us to have an understanding of what such families, and we have them around, sometimes in our extended family members. And even for me doing this, I've known them, but then this is giving me more insight into the realities that they contend with on a daily basis. And for me, this is also to get empathy, prayers, reaching out. And when I was even talking about support, maybe somebody to help babysit, just be there, just leave this boy with us, and you can have a life. And that's really what this is about. Yeah, watching Safe Space with Pastor Wale Afelumo, talking about life with special needs children. I'm here with Mr. and Mrs. Julius and Zainab Obomokhai. We'll be having a pediatrician, a doctor, join us for the second session. Remember to ask your questions. You can subscribe to the channel and just hang in there. It gets better. Now, let me ask you, what's keeping you going? Where have you found strength from? What's been keeping you going? You know, as you say all of this, or maybe two questions. You know, do you ever deal with quitting? You know, I say, oh man, you know, but then what keeps you going?
Well, I'll be a liar if I sit here and say I've never thought of, you know, just disappearing. Like,
Wow.
you know, just
Wow.
go into oblivion and forget about
Wow.
all of this. I'll be a
Wow.
very big liar. But then in all of this, what has really kept us going is the word of God. Because we find succor, we find solace in the word of God. Because God has said, I will neither leave you nor forsake you. And we hold firmly to his word. If not for our faith, like I said, the marriage would be long gone. In fact, I don't think I will have a family today. Because as a young man, that's our first child. Like, what sin did we ever commit to, find ourselves in this? But in all, the Bible says we should always give thanks to God. And Maximus has been a blessing to us.
Yeah, which was my next question.
Oh.
Unless she wants to say something about what keeps you going, do you want to add a comment to that?
No, I think my husband
Okay,
has said
fantastic.
everything.
I was going to say, tell us some of your happy moments, the miracles, because sometimes even in the pain, in the, like they say, in the disability, you see an ability, in the weakness, you see a strength. What are your happy moments, miracle moments, those special moments with him as you look at him as a child? Yeah.
As much as I wish that all is well with Max,
yes.
I love my son.
Awesome.
My wife loves her son.
Yeah,
And
I've noticed that with you people. Sometimes I look from afar and they have treated him like any other child. They carry him, they love him. You just see this connect in spite of all of that. Yeah.
We are very attached to the boy because I just know, however it turns out, God's name will be glorified at the end of the day. Because Maximus has also been, quote and unquote, a catalyst for blessing in my household.
Wow.
Like I said, it's our first child.
Wow.
When we had the second one, we didn't even plan for it. We were still nursing Max. It was one of those wild. It was one of those.
They didn't
wild
plan
nights.
for it. It just happened.
Yes, because even when she became pregnant of our second son, Sean, up to like over a month, she didn't know she was pregnant.
Wow.
We're busy treating malaria and typhoid. We didn't know that she was already pregnant. So, and we just give glory to God. Seeing Max smile, because that's the only milestone. I imagine having a child that is up to 3.
And
I can just see him. The smile gets to warm my heart because, to me, okay, that's
a flicker of hope.
Yes, the beginning of hope somehow. So it gets to warm my heart. And in fact, the way my wife carries that boy, as her husband, sometimes I feel jealous. She's always at his beck and call.
Well done. That's commendable. You mentioned something to my wife a while ago about a friend and their reaction, their attitude towards the boy.
Yes.
If you don't mind, would you like to talk about that?
Yes, I remember when my son was I think he was about 6 to 7 months old. A friend came visiting and I was like, please, can you help? Then you can't even tell that this boy has an issue. I was like, please, can you help me hold him? Let me quickly get something. She was like, no, I can't. I can't carry him. And it got to me like, hello, why would you say that? Is it because of what is...
the challenge.
In fact, the person even told me, are you sure this child is from God?
What?
Yes.
Wow.
I think that was why I reacted the way, because I actually asked her out.
Told her, such a person should live your life.
Our
last guest told us you don't need negative energy around you. Awesome.
So I asked her out, like, no, you can't. You said something like this before, that are you sure this child is from God? And now I'm saying, help me out with this child. You're still saying no.
Wow.
No, to me, I was really mad with that.
Wow.
And I had to ask her.
I'm sorry on her behalf.
I've even forgiven her. Funny enough,
Wow.
I've forgiven this person. She still come around.
Okay, well, fantastic.
But I know I did that to her then.
Fantastic. Does government do anything? Any help from government, some government agency to help parents like you or children, special children like Maximus? Have you heard of anything?
None that we've heard of. None that we've heard of. I don't want to say no, so that there might be one out there, but none that we have heard of.
So you've never received any benefit from government because you had a child, like this?
They would even take from you because.
Or maybe cheaper medical, knowing that this child will require more, like you said, physiotherapy, will require more medication, more attention than other children. Do you get any rebate on drugs for him and all of that?
No, most of the drugs, they don't even have it in the government hospitals.
Wow.
And they know the drugs are kind of expensive.
Wow. Yeah.
And they don't sell it in the hospital. So most of the time you go out to get them.
There's nothing from
You
the
go out,
government.
even the physiotherapy section they did not even reduce anything to say, okay, these children are having this problem.
Yes.
Per section, you pay 1,000 naira in some government hospitals.
Wow.
And you're only entitled to
And
like
just
maybe
like
1 or 2 sessions per week.
Per week.
Which is not sufficient.
Which
So you need to get
Yes,
you
it's
know,
so-
independent
yes.
extra
Supplements.
hands.
physiotherapy.
Yes.
Wow.
And even those
Physiotherapist.
sections, they spend maybe, some don't even spend up to 30 minutes with your child
Wow.
for the physio section. Meanwhile, they are supposed to spend more than that.
Wow.
Because I've seen some online and I see the time the
They spend.
physiotherapist spent on that, on the child.
Wow.
But I don't see that with our government
What-
physiotherapists.
Yeah.
Sorry, sir. There is this private organization in Abuja here, Brain and
Brain and Body
Brain and
Foundation.
Brain and Body Foundation.
Brain and Body Foundation.
Yes.
Headed
They
by
are-
one Dr. Ajibade. He's been helpful.
Yes.
You go to them, they give you
Supplements.
supplements for
Okay.
the brain, supplement for
Free?
muscles.
Yes,
Oh,
free.
wow.
Yes.
Free.
Wow.
And this supplement, they cost a lot, but he gives
Yeah.
for free.
Wow.
That's the only.
They give for brain and
It's not
nerves. They
government.
give for the immune, to boost their immune system. They give for gastro. They also have for bone, joints. And for the gastro is to help because they can't poo-poo easily. It is really, really a
It takes
stress
some
on them
effort.
to poo-poo.
Wow.
So that's for the gastro, it helps them to poo easily.
What would you expect our government to do? Because you just don't know who's watching, who has access, or who can, or the society. Can you say something?
Seriously, for special parents, I think the government should really come to our aid. There are some families and there are some parents that can really take care of their children without the aid of government. Of course, there are some that can really not do anything. There are some that are very, 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 very poor, and I mean it, very, very, very poor. So the government should do something about this. Just, I don't know, maybe subsidize these drugs for us, because these children are placed on different types of drugs like anticonvulsants down to brain enhancement drugs. The government should look for a way, perhaps maybe by insurance. That reminds me, there is this insurance I was subscribed to earlier this year. We had paid, a friend introduced us. Before we knew it, it took over a month, they returned our money. That we are sorry, we cannot.
Does
be
not
enlisted.
cover.
Yes, because of our special child. Basically, we actually did it because of the boy. They said
It doesn't
can't-
cover.
Yes, and I've checked all the insurance, health insurance,
Policies and
policy we
yeah.
have in this country. I've not seen any.
Wow.
I have made several calls. No.
Wow. Because and that is something our government really needs to take up, because these children are bona fide citizens of Nigeria. And actually, he mentioned a while ago that the church is doing something. And I remember one day I was saying, why isn't the government doing anything? And I just heard in my heart that you as a church, what are you doing? You know, and that's why we started that, because he's a bona fide member of our church, like any child at all. And so I think our government should do something about this. In other climes, the governments, you know, give special attention to these children. They go to the homes of the parents to remodel the home so that the child can live an independent life. There are medical bonuses extended to them to be able to help alleviate the problem on the parents, the pressure on the parents. And I think there's also some form of support that such parents will get. So I truly would desire that our parents will do that. As we round up, maybe my last questions, can you speak to parents like you? What word of encouragement? I don't know. What comes to your heart to say to them?
Well, let me put it lightly. My colleagues, I know, and I can feel everything, every frustration you are going through, every step of the way. We've also felt that way. We've also felt like quitting. In fact, there was a day we just sat and we're looking at the ground like, you know what? If you want to exit this world, just go. Let's have peace. Let's have peace. But in all of this, I know God has a reason
Yes, sir.
for these children. And indeed, well, as a Christian, I know that children are the heritage of the Lord. So God bringing these children our way, He will certainly make a way for us. These children will put a smile on our faces. So don't give up. Don't give up. Don't give up. Don't ever get tempted to poison your child, please. Because we've heard stories of parents that want to do that. In fact, there's a parent that somebody told to bring 8,000, that they will wrap the child and drown the child for them. Yes, the person called my wife. and we've been trying to talk to them and talk them out of it. And don't get scared of having another child. We were advised to have another child as soon as possible, and God heard our prayers and blessed us with another child. So when we look at Maximus, we are not too happy. We look at our son, Sean, it gives us joy.
Some consolation.
Yes, and we look at Max and we know that certainly all will be well. So please hang in there. Look up to God. God will certainly make a way for you. Thank you.
Thank you.
That's fine.
Yes, sir.
Okay. Usually I will do this. How can people reach you on social media? Somebody wants to contact you. Usually I like the social media handle.
Okay. I'm on Twitter.
Yeah.
I'm very active on Twitter. My Twitter handle is at J Obomokhai.
Okay, so usually we'll have that at the bottom of the screen.
Yeah.
The bottom of the screen, J Obomokhai, but you find the spelling there. You can DM him or write him or something. You're not on Facebook.
I'm on Facebook
As
Julius Obomokhai.
Julius Obomokhai. Okay, and
And I'm on Facebook as Zainab Obomokhai.
Zainab Obomokhai. So there's a case somewhere, so you will see it in the one we wrote underneath. I must thank the two of you for your time. It's been an amazing session. The doctor will be coming in and he will help us to make sense of all of this. I'll encourage you to also be glued to your computers or your mobile devices on Saturday as this, airs to be a part of this. Thank you so very much.
Sir. Thank you,
God
sir.
bless you. God bless you. Thank you. Thank you. Okay, my viewers, just hang in there. Just a very short break, like a 10 seconds break, and then we'll have our doctor sitting with us. Thank you for being a part of Safe Space with Pastor Wale Afelumo. It continues shortly. Remember to hit that subscribe button, subscribe to this channel, and ask your questions, and we'll be on hand to answer. Thank you. Welcome back, viewers. This is Safe Space with Pastor Wale Afelumo. Our second guest is with me in the studio, and I'll be introducing him very shortly. Remember to subscribe to this YouTube channel and like the Facebook page. And remember, you can ask your questions live. The doctor will be on hand, and I will be there to answer some of your questions on the chat box. My next guest is an amazing gentleman. He's a medical doctor. Dr. Babatunde Abegunde is the Deputy General Manager and the Medical Director of NEMSA Medical Center, Maitama. And NEMSA is Nigerian Electricity Management Services Agency. It's good to have you in here. By the way, he's had his residency in pediatrics.
Residency training in pediatrics, yes.
In pediatrics, yeah. And he's worked with children. Sometimes it's hard to look at our children. And interestingly, he's been a doctor to the child of the parents that just left the studio in a while. You're welcome, doctor. Good to have you.
Thank you. Thank you.
Thank you for giving us your time to be part of our program.
It's a pleasure.
Thank you very much. And how's your family?
We're back. We're very well.
That's good. That's good. So the Obomokhai is just left, and they have a special needs child. And by the way, we're talking about life with special needs children. Now, the first thing I want to ask you before we maybe delve into particular things about them is what are some of the categories of special needs children?
Okay. Broadly speaking, it's divided into 4.
Okay.
You have those that have physical challenges.
Okay.
Those that have developmental challenges.
Okay.
Behavioral.
Okay. Wow.
And those that now have sensory deficits. So now, those are physical. Those that could have things like muscular dystrophies, in which case you have issues with mobility, you need help moving along a lot of times. But there are other spectrums.
What does dystrophy mean? I only know atrophy.
Well, it's impaired muscular function, and with that, it worsened. It's not very common in this part. Okay. But you also have things like a meningomyelocele. A child is born, has something like a pouch at the back, at the lower back. And in that pouch, there are parts of the spinal cord there. The lower limbs will not work. It would almost give a picture of a child being born with polio.
Wow. So those are the physical, you said they
those are the ones under for physical. Developmental, you now have things like autism comes in there. Also things like Down syndrome.
Down syndrome,
Yes, those come under developmental. And for behavioral, there are children that have attention deficit disorders. Yes. And some others like that. Then, of course, the sensory impaired ones, children with visual impairments, auditory impairments, those that are deaf or have some
those are the ones with cognitive impairments?
Cognitive impairments will fall under developmental. Okay. That's where, so things like Down syndrome, they have some level of cognitive.
So where will cerebral palsy?
Cerebral palsy on its own is more under physical because by definition, cerebral palsy, there has been some damage to a developing brain and which leads to a chronic disorder involving motor and posture. So they have issues with movement.
Motor means mobility?
Mobility, things just basically movements. Then they too can have comorbidities, other issues, depending on what caused it. So there are some that would have their cognition intact, but have issues with mobility, some forms of cerebral palsy, while some would have a combination of delays in development, attaining all across all these
developmental milestones.
Yes, not just the motor ones. Even when it now comes to cognition, social impairments, things like that. They also, so cerebral palsy can cut across.
So is there a medical consensus, and pardon me, like I said, I'm a layman, is there a medical consensus on what may be the cause for these things, or what have you noticed that are more preponderant in causing these things?
Well, in different societies, there are different causes. But remembering that it's such a wide range. Because you have some children that have seizure disorders, what we used to term epilepsy. They're so bad that they now have difficulties with each seizure. There's some level of damage to the brain. So if it continues for long, at the end of the day, you now have a seizure disorder, also now ending up having cognitive impairments. You can't learn as much as others would. Then, I could go back to cerebral palsy again. With that, depending on severity of the cause, a common cause here in Nigeria is birth asphyxia or perinatal asphyxia. Basically meaning that the baby had some form of insult that didn't allow oxygen get to the brain. During insult or injury, that didn't allow the child have oxygen. So more commonly, the baby didn't cry well. What we see here is that the labor process is going on. The baby should come out within a certain time, but either the baby is too big or the baby is in the wrong position, and they're still insisting that the baby must come out the normal way rather than have a cesarean section. So the baby gets asphyxiated. At some point, eventually they will now lead to perinatal asphyxia. So one of the causes is that if the mother of the baby ends up in labor in a place where a cesarean section can be done on time, when there's some form of distress, that can happen. Remember, we spoke about cerebral palsy being injury to a developing brain. So anything that would occur more often than not in the first 2 years of life can lead to that. So commonly things like jaundice, when it's severe, can cause that. Things like meningitis can cause it. Even hypoglycemia, meaning there's too little blood in the baby's bloodstream, leading to convulsions. That too can end up causing that. Even good old, I shouldn't say good old, malaria. Because there is a form of malaria, cerebral malaria, that can lead to that as well. So the spectrum is quite, and that's just one. While other things like autism, we don't know what's causing that till date, but children are born with it. There are some congenital infections, basically meaning the mother could have had rubella, German measles, in the first trimester of life. And then the baby is born either having visual impairments or even hearing impairments. So it's a lot.
I read something, and I wish I could remember very well about it's called something alcohol, something.
Okay, very good.
That is from mothers who consume alcohol.
Very good. It's
pregnancy.
called the fetal alcohol syndrome.
Fetal alcohol syndrome.
Yes, so mothers that take a lot, especially in the first trimester, the first 3 months, usually actually in the first 8 weeks of pregnancy. If you're taking so much of that, then the baby can also end up being born.
So that means your lifestyle while you are pregnant too is something you should look into.
I spoke about meningomyelocele. That's when the baby comes with a pouch on the back and cannot walk. It's one of what we call neural tube defects. Now, in that one, the mother is expected to take folic acid. So one of the things we preach that women that want to get pregnant should take folic acid.
Where do you get folic acid from in its natural form?
In natural form, green leafy vegetables.
Ugu.
Good old ugu, yes. They have that. But, so what we do in antenatal now, we give folic acid, which helps to produce red blood cells. It's part of that. But also it helps in preventing neural tube defects. So it's better taken even before you're considering getting pregnant, so that the levels are high. They found out that those that have lower levels of folic acid are at an increased risk.
Malformed children.
Yes, of having neural tube defects, yes. Okay. So, which is another thing. Then you can also go to things like Down syndrome. There's that story about women who are above a certain age, there's a higher risk of them having it. But in reality, up to 70-80% of all children with Down syndrome are born to women that are less than 35. So there's still
a debate.
Yeah, well, it's not a debate, but it's known that it's much
higher.
It's
non-conclusive.
You know, it's higher in women
who are older.
Yes, who are older. There are ways of actually testing.
What about the chromosomes, the Y, the X, do those come into play?
Chromosomes, well, there are some syndromes that have to do with chromosomes. A good one actually is Down syndrome, when you have 3 of a certain chromosome at a certain. But all in all, they're not too common.
I just felt to say, interestingly, the couple that just left, I had asked them if what regrets do they have, and one of the things the only thing the father said is regret, that where they were doing the antenatal before, I don't know what the medical team there saw. They had suggested a cesarean section, and he got angry that no, for what reason, and they went to a place, and now he looks. But now listening to you talking about if there is, pressure, too much, as a word I'm looking for now, too much strain when the child is being born, or stress when the child is being born, and the oxygen is not getting to the brain, can affect the child. So the labor period, and so he regrets that. So I know that many Nigerians, when we hear, CS, we just really, I think it's one of the safest today.
To us, yes.
Yes, it's one of the safest ways to have a child now.
We insist on that because we've seen what it can cost for a child that did not cry at birth. We've managed it. Many die at birth, but many now live on, and the parents have a lifelong regret.
I remember when we were going to have our first child, and here I was, a pastor, and the doctors had told me, so my wife was hooked to all kinds of monitors, and I could see a heartbeat, and I could also monitor what was happening to the child. The child was distressed. She wasn't dilating enough. The BP, whatever heart rate of the child was dropping. The doctors were saying CS, and I had a church member, they say, Pastor, no, we forbid it. I said, please bring me the form, and I filled it and said,
beautiful.
And eventually when with the child, we realized that his umbilical cord had tied, and trying to deliver a child like that may have just created. So some of these things can be avoided, and the doctors are not your enemy. Really, it's just good to know that. It's just good to know that. How normal a life can some of these children live?
It all depends on many factors, actually. The severity of the underlying cause of the special needs. There are those that have multiple morbidities, illnesses at the same time. So a child who's having cerebral palsy, which basically means he's going to have delays in reaching his motor milestones. It's not going to walk. Maybe some would walk as late as 5 years rather than 18 months, which we would expect. And the same child now can have things like seizures or even feeding problems or breathing problems. So you have a lot. Those that now have relatively milder things. Okay, a good example is autism. In autism, the problem actually has to do with the child in the social sphere. So the child, not baby, isn't able to actually, it's like living in his own world. Some function, some are high performing patients with autism. They can do a lot, but they just do not interact well. Some have problems with communication. Children with Down syndrome, they also have some delays because they tend to be floppy at birth, basically. So they would have delays in walking on time and things like that.
How can a parent know that, so you just had this new baby, people come around your hospital bed, celebrate you, coochie coochie to baby's cheeks and all of that. How early can a parent know, and what would be the telltale signs, at least obvious telltale signs?
Okay, so telltale signs would also depend on which one exactly it is. For a baby that didn't cry well at birth, one of the easy telltale signs would now be that the child is not able to latch onto the breast. One of the things, because it's once a baby is born, what you'd expect, you put the baby, baby will be able to suck very well. But now, what you now see is that the baby is not able to attach and stay on. So the baby, so with that, you'll be like, okay. Or you have a child that's just sleeping too much, not crying for food, not making. So that's early enough. But over time, by 3 months. Seizures, though, definitely. When you have seizures early, that's also a sign. Or if a child has jaundice, it's so severe, the child stops sucking. We know that at some point in time, if nothing is done, the child may have sequelae later on.
It's always just good to seek medical attention. If you notice anything.
Early, yes. And one of the things that we also learn is that maternal anxiety, a lot of times, should not be overlooked. Especially a mother who's had other children and has noticed something about this particular child. Maybe he's not playing, or if you notice, okay, at 3 months, they're putting bright lights across or objects and the child isn't using his eyes. To stimulus. So those are some of the signs. But for some of them, it would actually take a little longer.
Are they redeemable or reversible? How much of help can
okay help?
Does early detection help?
Early detection can help a lot, depending on which one it is. But for some that are quite severe, there's really
maybe we should focus more on CP.
CP,
especially that's what
cerebral palsy. When it comes to cerebral palsy, one of the things we like is the major thing we preach is to prevent it. There are things we know can lead to it. So whatever you do, just do your best to prevent it.
The prevention will be
antenatal, proper antenatal, proper delivery in recognized settings. So I, for one, will never agree to anyone going to deliver in a church, no matter how spiritual you are. And we see it. We still have it till date. Because you're putting the child at risk. You're putting the mother herself at risk. She starts bleeding. What do you do in a church? Prayer is not going to push the blood back. So things like that have to be there. Of course, the mother making sure she's not taking unnecessary medication, because there are certain medications that can actually
maybe
unprescribed, unprescribed. Yes, making sure that the ones that are prescribed, you're using them. Then there are also things like early presentation in hospitals. So a good health-seeking behavior would always help once you think there's a problem or the other.
Thank you, Doctor. We are on Safe Space with Pastor Wale Afelumo and with Dr. Tunde Abegunde. We're talking about life with special needs children. Remember, you can subscribe to the channel. You can ask your questions, and we will be able to ask those questions. Now, Doctor, I've seen parents. Well, I remember one that they have children like this, and I guess maybe it's also stigma, society. They don't know what to do, and these children are just locked up in a room, just kept there, away from. What would you say to parents like that?
The truth is
and maybe you can you can talk.
The truth actually is that caring for a child with special needs is quite demanding. One of the things they need a lot of support. A lot of support, a lot of patience, a lot of commitment to that child. These children, to be honest, are at risk of being neglected. There are places we've heard where the children are actually killed just to allow the parents have some sort of breathing space. They spend so much. We're in a country where basically health expenditure is out of pocket for more than 90% of Nigerians. If that kind of child there are legislations outside where once you have a child like that, they are mandatory, the government takes care of them. All the help you need to an extent will be given.
Doctor, talk to our lawmakers, and because that is really very, just listening to the parent that just left, I just really felt heartbroken because it's practically drained them.
True.
You know, taking care of that child. And I'm like, we're in a society that doesn't even consider these children as, because they are bona fide citizens of Nigeria, you know, and for being special needs children, it just really means they need special care and special attention. And I'm really hoping that perhaps our government can, you know, come up with legislation. What can we do?
What can we do? Well, one of the things that the government can do actually, and the interesting thing, I read about there was an act that was passed into law last year about disabilities, those with disabilities. A commission was supposed to be formed, and then there were certain, there will be consequences of discriminations against them. So they're moving a bit in that step. But now, basically, this affects mainly adults that now have disabilities. Because I was reading through, I didn't really see anything specific for children. Help. There is a lot of help needed. These children will need medical attention far more often than every other child. So if there was a way of making healthcare as close as possible to being free for them, it will go a long way. Then we also have to evolve a lot of the other, how would I describe it now? Things like schooling, like, evolving,
educating them,
apart from
integrating them
just
into,
very good. That's the word I'm looking for. A way of getting them integrated. Schools abroad now, you have children with special needs. It's mandatory that they must go to the usual schools. There shouldn't be any form of discrimination because there will be consequences for those that do such. But we've not gotten to that level. Even schools where you train people that will care for them are not very available in Nigeria. There are some, but...
Actually, next week, if you are listening, a parent or you know somebody like that, in 2 weeks' time, SafeSpace comes up every 2 weeks. We're talking about what next, and we're having an educator, somebody who does vocation for people in this group and train them. So it will also be something you want to be a part of, to listen to. You know, I heard that abroad, well, when parents have children like this, it's like government just comes in. So maybe they are registered or something. There's some stipend they get from government. In some cases, they even come and remodel the house in such a way that the child can have some independence, a particular kind of bed, kind of bath and all, bathtub and all.
Wheelchairs. Things like that are actually given.
Yeah.
I have been to places where I've seen what they've done.
Raise your voice.
I'll use Japan as an example.
Yeah.
And I've been where a baby was born and same thing. For 9 months, the baby was in a neonatal intensive care unit. And at the point of getting this baby ready to go home, they were teaching the mother how to handle a ventilator. The baby couldn't breathe by 9 months.
Wow.
And they would go, the nurses would go and check on the baby. So there's so much support that such babies eventually will get as much help as they can get. In Nigeria, a lot of it is private sector driven. The government is battling to even take care of every other thing.
Yeah.
So it's going to take a while for it to evolve. But the first,
that would include maybe even medical professionals. Because listening to the couple that just left at our popular specialist hospital in the city, I don't know now if it's an issue with professionalism or just poor customer relations cases, but they were kept in the dark. They were not properly told what was wrong. They were being, and then they said at some point, the people having to carry books to even read, it's like they were not even familiar with what. So can you say one or two things?
One or two things about that. A lot of times you have certain things evolving. So it may not present like everything you've seen.
Everything you've seen before.
Once there's a change and you're looking at, okay, now this is a new development. So they could go and check.
It wasn't wrong for them to research.
It's actually safer to do that.
Yeah.
But about customer care and all, we're getting better. We're much better than when it was. When we had nurses and doctors being know-alls in the public hospital setting, where I think we're a little better now, but we can do much more. So parents are always advised to ask questions. And of course, hopefully they will get as much information as possible on what they're dealing with. But subspecialties such as, one of the things that's easily forgotten is the psychological states of the parents, of the caregiver.
That's so true.
So normally we'll just come home, the child's having convulsions, so just treat the convulsions. But now knowing whether this woman, it's easy for such parents to delve into depression. Lots of times the mothers, because they are the ones, life practically stops to take care of this child. You can't go to work. If you go to work, you have somebody caring with the baby, you're like, okay, your mind is always back home. I hope they've not done this. I hope he's not choking while being fed. I hope. So the other things added, even occupational therapy, how to get aids, prosthesis, or a wheelchair that the child can actually handle by himself, rather than needing somebody to move them around. So things like that, and getting there available at a high cost. And there is no government support. So at the end of the day,
it just tells a lot on
the parents can actually end up in penury, just having one child like that.
Wow. We're talking about the parents who may have locked the child, somewhere. What kind of medical help? I know in malaria, I talk about combined therapy. What kind of additional therapies are available, at least what we presently have, that can help to manage those children? So there is oral medicine. What else can they get to help them?
Okay, so with them, a lot of them will need physiotherapy.
Okay, that's physical therapy.
Yes, physical therapy. They will need things like nutrition. So you're actually making sure that the calories this child is getting enough, is getting the right types, is going well to an extent. Then, of course, the mother is getting psychological help.
The need for speech therapy in some cases?
Definitely. Speech, they would visual AIDS may be necessary, or even auditory AIDS. So there's so much more. But I would like to give an example of my niece. She was born outside the country, and in the first month of life, or thereabouts, they noticed that she had problems hearing. So she was started on hearing aids at that age.
Wow.
And we don't have routine.
Did you say in the first month?
Yes.
Wow.
So they're able to, in the first few days actually, or even months, they were able to detect, okay, and this, notice there's a problem here. And they intervened. In Nigeria, the average newborn is not going to have any auditory test. So those are things government can do. If it becomes mandatory that every child, before you go home from delivery, all sorts of tests are done.
Things, yeah.
Automatically, you'll be able to find out early enough. Even the AIDS, getting the AIDS in Nigeria is another issue, because you're supposed to now get one that is the right size and that can function for that.
Wow.
But the more we start, the better we'll get at it, and the more we can help these children.
Wow. Can you, our time is really fast spent, and I'm enjoying this. I wish we could talk some more. Can you just give a word of hope to parents with, with children like this? Yeah.
With children having special needs, it's not the end of the world. Many of them actually can get to function to an extent, but they also need, for society, for the parents, they need a lot of support. That's family support, even the environment. A lot can be done, and we pray that at some point in time, the government will get to that state, to the level where much more will be done for them. But the parents need a lot of patience. They should also, one other thing they must know, that it's, a lot of times it's not their fault. So they shouldn't kill themselves.
That's so important. Regrets. It's not their fault.
It's not their fault. A lot of times it's not. And even if it is, it's not the end of the world. The child did not have a say in what happened. The child doesn't decide to come out being a child that needs special needs. So a lot of the frustrations, anger, and all should not be put on the child as much as possible. A child with attention deficit disorder, for example, they tend to be the ones at 4. The child is not sitting anywhere. He has beaten the child, beaten for something that the child really can't control. So it's good to seek medical help on time. And with that, you can get as much help from the medical side, hopefully from the social side as well.
Awesome. Awesome. Now, I know you're a very busy person as I round up. How can people reach you if they must? I don't know if you will want that, but then even if it's for it's social media, at least, I like that. How can maybe your social media handles, if you want to ask? But, yeah.
Well, okay. I am on Instagram actually. I'm on Facebook as well. But okay, I can always put my link on.
Just tell us. We will write it down.
Okay. For Instagram, I'm at Abegs Inc.
Abegs Inc. Okay.
Yes, at Abegs Inc. That's for Instagram. For Facebook, it's Tunde Abegs. And I can be reached there. Okay. And I can also be reached at my hospital. Because the hospital, is it open to the public? Yes, it is.
Oh, it's open to the public? Yes, okay, so we'll also put the address of that hospital there. NEMSA Medical Center. It's in Maitama?
Maitama on Minister Hill.
Maitama, that sounds like for the big boys.
It's not. Well, since it's a government-owned medical center, it's not.
Okay. Fantastic. Fantastic. Thank you so very much, Doctor. Thank you for shedding light on this. I know there's so much to cover. So much, just really so much. I just try to do this to bring awareness to some of these issues. Also, I'm hoping that it will strike a chord with somebody who can do something. Our government needs to do a little more. You know, when you want to check, I know that health is one of the indexes they use to check, how well a country is doing. and our health sector really needs help. I know COVID has come to open our eyes to some.
To see that, there's also the Ministry of Women Affairs. They also have something that they can actually do. There's actually a department there that is involved in child protection. So things like that. They too, if they can step up their game.
Okay, well, fantastic. Thank you very much. Thank you very much, viewers. Time will not allow us to do much more than we have done. But I want to also say to every parent there who has a child with special needs, you haven't done anything wrong, neither has your child done anything wrong. The people who have their children running around the streets are not any way better than you. So remember that you owe your children love, just like you will love any other child. Sing to them, just what you will do to your other children. Know that even in those seeming weaknesses, there are strengths there. You want to find those strengths and celebrate them. And we heard our couple said that earlier, that you find something to celebrate, to rejoice about. I also would like to appeal to our government, to people who can do something that this is something we should take seriously. As you can hear, doctors said that it can actually lead a parent or parents to penury, just trying to take care of children like this. And they are bona fide Nigerians, they are citizens of our country that should also be looked out for, much more than even people who can help themselves. So it's something that we should pay attention to. And for us, general public, if there are ways you can help, so this thing drains their pockets, drains them emotionally, that you are empathetic, that you reach out to some of these parents. If you can also help financially, you know anybody around. Now you know that if somebody has a special needs child, they are spending more. Even if those children are in school, their schools are more expensive. They just told us, a couple told us about a drug they buy for 45,000 naira or something they have to do for 45,000 naira. They're paying for physiotherapy every week. That we all, put our hands on deck to help these children. I read something this morning, just a little bit, that when your income increases, don't let your spending increase, let your giving increase. And so all around us, we can do something to be a blessing to families like this. As a church, we adopted our little boy and we put him on a stipend every month to help with some of the medication, and you can do that too. Thank you very much. Remember, next week we are having a specialist, and we continue in this topic on how to integrate them into life as she trains them in vocation, education, and things like that. So remember to get your friends to watch. SafeSpace continues in 2 weeks' time, subscribe to the channel, get the details at the bottom of the screen, the social media handles of Doctor, and you can further contact us. My name is Wale Afelumo. It's been an amazing time. Thank you for giving me a portion of your Saturday to be a part of this program. God bless you. You matter to God. Have an amazing day. Bye. Thank you, Doctor.